guys, welcome back to my channel, The Jamie Nicole, and today is day 2 of my nursing school marathon. Before we get into the video, be sure to like, share, and subscribe to my channel. It costs you nothing, but it does wonders for me. But today I'm going to be talking to you guys about what do nursing students really do in clinical. Before you go to clinical, sometimes, there's not really like a clear-cut description of what exactly nursing students do in clinical. I'm pretty sure everybody has the idea of like, okay, you're there at the hospital, learning how to be a bedside nurse. Different programs have different protocols, different privileges, and as well as different hospitals have different privileges and access points or whatever for students. So with the pandemic, that's also changed some of the privileges that students have at clinical. So, being that I started clinicals in fall of 2020, I can only speak on the experience that I've had since COVID has started. Luckily, I've still been able to go into the hospitals with each clinical rotation that I've had. So, with that being fundamentals, adult health 1, and OB, I've been able to go into the hospital with each rotation, and I've gained a lot of experience from each of my clinicals. Now, not all students will have the exact same experience as me, so I can only speak on what I did. I believe that what you do at clinical is what you make of it. So yes, we're all gonna show up to clinical super early in the morning, more than likely somewhere around 6 o'clock, maybe 7 if you're lucky. And you usually will have like a pre-conference with your instructor. They'll give you guys a breakdown of what you're going to do today on the unit. You get your patient assignment. Most time, if it's the first day or orientation or anything, they'll explain the rules. They'll give you a tour. It's like a lot of paperwork talking. You'll learn how to chart all that. But I'm going to talk about mostly like a regular clinical day. So like I said, you'll have pre-conference, get a whole breakdown, game plan of what you're supposed to do. Depending on the clinical instructor, they may give you like a checklist of things they want you to do during the day, or if your instructor is more chill, they may just give you your patient and go on with the day like that. So when I say clinical is what you make of it, once I would get my clinical assignment, and luckily I had some experience in the hospital around the time that I was starting clinical. So of course you always go up to your nurse, introduce yourself, say how long you're going to be on the floor, say the duties that you are able to do. And what I would always say is that I am willing to do anything that will give me a learning opportunity. If there's anything interesting or just anything that you think I should do, please ask me to do it. I will always be sure to make that very clear with my nurse, because I never wanted to miss out on any opportunity. I wanted to be able to do everything, because essentially this is the one day a week that we get to really be in the shoes of a nurse for however so many weeks, however long your rotation is. So I feel like it's smart to fully take advantage of that. And I also saw on YouTube that nurses really like when their students step up and they want to get their hands and stuff and they want to be involved. It shows that you're really committed to what you're doing and that you're interested in learning more things. If you kind of just stand around or sit around and you're just on your phone the whole time, you're not really asking to do anything, you're passing up on duties, it makes it seem like you really don't want to be there. I will always take that extra step to make sure that it was made clear that I will literally do anything. Throughout the day, you really just follow your nurse around. It's funny because at the last rotation I had, which was OB, and you guys will be getting a story time on that pretty soon. But yes, at my last rotation, which was OB, I would always say to my nurse, like, I feel like a lost puppy because when there's not really much to do, or when it's that time in the morning where your nurse is getting report and all that, you're kind of just following them around the unit and you don't really know what to do and you just kind of feel in the way. But do not feel bad about that, because the nurse gets it. Like, they know how awkward it feels, and you're there to follow them around. So if it's a slower day, which typically that only really happens on OB floors or labor and delivery floors if nobody's having a baby or there's nothing going on. That's where I experience the most slow days. But if you're on like a med surg floor, ICU, anything like that, you're never really gonna have a slow day. So essentially, how I would define it is that you're kind of in a segue between being the nurse and being the tech. Because since you're that extra help to the nurse, a lot of the times the nurse will ask you to do some of the things that the tech needs to do just out of common courtesy, since you are an extra pair of hands on the unit. So if a patient has to use the bathroom, it'd be kind of rude and inconvenient to call the tech and ask them to do it when you're literally there and we're trained to do that. And you could easily do that, get that out the way for them so that they don't even have to worry about that. And I say that because I've been a tech for a few years, so I understand how it feels to, you know, be busy in the midst of your duties, and then there's a student there and they don't, like, you're not obligated to help the tech, but it's just like bedside courtesy, you get what I'm saying, to help each other out. Like I said, segue in between the nurse and the tech, so you'll be helping out the tech in whatever they have to do, but then when it comes to passing meds or any like small procedures that your nurse has to do, you're gonna be there helping her with that. And if you're lucky enough, then you'll be able to perform those duties yourself. I would say that when it comes to something that you may not have ever done before, per se on a human, do not express that to the patient. If I were you, I would always speak to my nurse privately, you know, when she first asked me, okay, do you want to do this? Then I would just say flat out, like, okay, this is my first time doing this on a human. So like, is there anything I should do? You know, ask her that, and then she can decide whether or not she feels comfortable letting you do it by yourself, or if she just wants you to assist her in doing it. Never express your fears, worries, or doubts to the patient, because then that can affect how they feel about it, and then they may not let you do it, you know? Oh, and I also like to add, because of that assertive nature that I always enter clinicals with, I've had the pleasure to be able to do a lot of things at clinical. I've inserted probably over like 20 IVs, I've drawn blood, I've inserted Foleys, I've helped with fundal exams, I've gotten to see multiple C-sections, vaginal births, I've done a lot of lab draws and lab catches, so like urine, stool, which sounds gross, but if you really want to do something, then, you know, I feel like you can't, you know, I try not to turn down stuff, so that sounds gross, but hey, I got the experience of it. I can't fully think of everything off my head because my adult health and fundamentals clinicals were over a year ago. That's just a handful of the things that I've gotten to do. So I just really want to emphasize to you guys, do not be timid, because I feel like people who have horrible clinical experiences, part of that could be because they're not putting themselves out there. They're not taking that extra step to, you know, put themselves out there, like I said. Now, another part of why people have horrible clinicals is because some nurses like to forget that they were nursing students at one point, and they like to be horrible to students and say that they don't want students and they may not let you do anything, and then you literally just follow them around all day, and that's boring. Nobody wants to do that. Honestly, I don't even know what to say about that, because it doesn't make sense to me, because if they don't let us do anything, then how are we supposed to learn? So if you do come across a nurse, or you're assigned to a nurse who doesn't want a student and they act kind of nasty towards you, I would suggest, one, speaking to your instructor and, you know, letting them know what the situation is. You may be able to get switched possibly, or they'll assign you to someone else. And if not, I would definitely just kill them with kindness. Come with your best attitude and still show your desire to want to learn from them. And majority of the time, that'll change their attitude, because they'll essentially feel bad for treating you horribly. In the downtime when you're not performing duties with your nurse, that's when you're taking time to chart different things, and they'll show you different things in the system. They'll talk to you, well, like I said before. So a lot of the things that you learn in clinical comes from you asking. So even though I said they'll show you different stuff in the system, most of the times you have to ask them, okay, so what does this mean? Because that nurse is at work. They may not be thinking about 24/7, oh, let me tell this student this, let me tell them that, let me explain this, let me explain that. They're at work, so they're just in their regular, flow of things. So sometimes you have to like pause them and be like, oh, so what do you do with this, and what was that like that we saw in the room that we couldn't talk about in the room? So and just take that time while you're sitting down to ask them questions that you think of during the day, and questions that you may not be able to ask in class. So ask them real life questions, you know what I'm saying? I typically always start off with like, how long have you been a nurse? Just to break the ice, and then it'll flow into different things, different types of conversation. I've had nurses help me with my clinical paperwork, my care plans before, so that's always a great help, because if you know what a care plan is, I hate care plans. I hate clinical paperwork so much. Yeah, so let's get into that. So if there's not much going on your floor, the majority of your time at clinical, you will just be working on your care plan and, getting all your patients' meds written down, and the entire case, and interventions, all the nursing diagnosis, all that fun stuff. You'll be filling out that paperwork and just trying to make the time go by faster. There's literally no other way to put it. So that's why I wouldn't wish a slow day on a unit to anyone, because it is absolutely boring. In the midst of the duties or whatever, I've always gotten a lunch during clinical. You take lunch typically at the same time as your nurse or your instructor will have your whole clinical group take lunch together. It's usually about 30 minutes, because that's the time that nurses get for their lunch. It's typically midday or midday, depending on how long you're on the unit. I haven't had a 12-hour clinical before. Longest I've had is about 10. So we will always take our break, a few hours before we're about to have post-conference and leave the floor anyway. So after you have your lunch and it's your time to leave the floor, then it'd be time for post-conference. Post-conference is where your classmates and your instructor all meet up, and whether it's a conference room or wherever, you all meet up somewhere privately, and then everybody talks about their day. They talk about the duties that they performed that day. You typically have to turn in your care plan at that time. And yeah, it's really just a debrief, and you find out how everybody's day was. And honestly, if it was a rough day, those can drag out pretty long. But I prefer for them to be around 30 minutes or so, because you're tired at the end of the clinical day. So to wrap everything up, like I said at the beginning of this video, clinical is what you make of it. If you can, try to do everything, of course without taking different experiences from your classmates, but always put yourself out there. That's how I have gotten the most out of my clinical experiences, and that's why I really enjoy clinical in comparison to the rest of nursing school, because I feel like that's the time where I get to show the things that I've learned, and I get to also make a good impression to the people at that hospital, because I believe that every day is a job interview. You never know if after you graduate, or before you graduate, if you have to apply to that specific location. It's gonna be good and an advantage to you if when you were there for your clinical rotation, the management knew, okay, Jamie, she was on her stuff, she was a good student, she was always respectful, she communicated, and she had great ambition. So that's another reason why you always want to be on top of your stuff and give 110% every clinical rotation. It'll be early in the morning, and it may be hard to always feel ready to go and whatnot, but sometimes you just gotta suck it up and do what you gotta do. This just made me think about, so if you guys want like a what I wear to clinical video, or like a clinical get ready with me type of video, make sure to comment down below. Comment down below if you guys want more like clinical explanations, because I've noticed that different schools have different clinical policies. So if you guys want to find out more about the policies of my clinicals, then comment down below. Okay, that's all I have for you guys today. I hope you enjoyed this video. Be sure to give it a big thumbs up. And as always, subscribe to my channel if you want to see more of my content. And I will see you guys tomorrow on day 3 of the nursing school marathon.